Understanding carrying capacity uh, is very important. And carrying capacity is not a new concept, actually, and urban planners study this. But apart from urban planners, architects, builders, MEP people, or people who are into wide variety of development do not understand what carrying capacity is. And when you typically go to get an environmental clearance authorities do understand what is carrying capacity. And every time a project proponent gives a project saying that, I am doing minimum harm to the environment and to the place that I am doing the development, and the project gets approved because the impact is minimum. How is the impact minimum? And is the cumulative impact being considered over a period of time? Because as the city builds, each of these minimum impact projects lead to maximum cumulative impact. And this is what burdens the regional carrying capacity or the carrying capacity of a city or a location. And there are limitations to this growth. Today, we'll be discussing some of these principles. Next slide, please. Yeah. So it is not a punitive ceiling. It is an adapted framework for managing risk and spatial equity. And we have to look at it in four types. One is the physical and ecological carrying capacity. Please keep it on that slide, which talks about land resource, water and air shed, and which primarily is the primary limiting factor for urban growth. Because we have to remember that we are in a physical space. There is infrastructural carrying capacity, and there is a threshold to how much infrastructure, what is the absorptive capacity of the current infrastructure, and what can trigger operational disruptions for a city. There is a governance related carrying capacity, which talks about urban systems, institutional ability to govern, moderate, and integrate all the domains asserting to a urban local body. And then there are public health limits. These are human, biological, and social tolerance to the population density, environmental pollution, and disease transmission. So all of these are linked. And if you look at this figure, it almost looks like a swastik. And this is the theme, which is theme of carrying capacity. These are the types of urban carrying capacity, and this has to be studied when we go for a development. And as the city develops and more private sector development happens, it is important to understand what is the cumulative impact and what it does to the urban carrying capacity. Next, and pushes governance to a limit and infrastructure to the limit. And India is at an urban tipping point. There is a structural crisis in megacities and tier one, tier two regions, and it is linked to the ecological support boundaries. We are expected to have 600 million projected by 2030, 60% surge in urban residents in 2 decades, 30% green cover lost, 64 meters water table decline, overextended urban aquifers, and a 3x density pressure in tier 1 cities as the average FSI demand versus the planned capacity. And there's an alarming gap in what actually is the norm versus what actually the reality. The residential density is several fold higher. On an average, we are looking at 447 pph in core wards, that persons per hectare. Wastewater treatment, only 28% of wastewater is treated, 72% is discharged raw. Urban green space norm is 10 to 12 meters per meter square per person. But in reality, it is 1 to 2 meters square per person in major cities. And climate hazard exposure is humongous. All of us are exposed to climate hazards. 80% of residents in high hazard districts across India. 360 million exposed to extreme heat by 2050. All of us will be affected. Most of us will be affected, but the poorer will be affected more. So there is an inequity associated with all of this. Next. The ecological carrying capacity, there are four primary natural systems. across, not just in India, but in India, they are under acute stress, each breaching irreversible ecological thresholds. We're talking about regional airsheds, and these airsheds are 5 to 10x what the World Health Organization prescribes, especially across the Indo-Gangetic Plain. Urban aquifers are extended. Extraction outpaces the recharge, 3 is to 1 ratio annually. Permeable soils are missing. Paving eliminates groundwater recharge. There is monsoon runoff without infiltrating. This increases flood risk. How many cities are flooded on a regular basis? Urban forest canopies and urban tree cover is disappearing. And due to this decrease, there is an increase in the nighttime temperature. There is an amplification of the urban heat island in core areas of the city. Next. India is under ecological stress even from the basic element of water. And if climate change is the shark, water is the teeth, we will feel the stress through water. 22 to 46% nationwide deaths are caused by environmental degradation over a period of 2022 and 24. The carrying capacity of hill towns, and especially we are looking at the case of Nainital, number of visitors that it can actually sustain with its ecological and resource constraints as opposed to what daily visitors it is getting. The real number of visitors is far, far higher than what it can sustain. And as we do more and more studies of all different types of cities and towns, and we will understand uh, each location has a different carrying capacity based on its climate, based on its geography, and so on and so forth. Next. The infrastructural carrying capacity is significantly low. Only 28% is treated in India. There is a cascading failure of stormwater contamination, groundwater pollution, and increased disease. 351 critically polluted river stretches nationwide. So we are just shutting our eyes to this problem. Untreated goes into local drains and rivers and lakes. And this is a crisis because it is a health crisis. And we are not recognizing that. Next. Let's take the case of Bangalore in terms of infrastructural stress. What should be the average water supply? It's 2.5 hours per day currently. Citizens heavily rely on borewell. Unsewered households, 30%. Solid waste management, unprocessed waste dumped in unscientific landfills. And imagine, Bangalore is a city where segregation happens and there is so much awareness. And still, 80% of the waste is unprocessed and it's going to unscientific landfills. 7.13 lakh slum residents, lack of affordable housing leading to communities and slums living near landfills and variety of diseases and waterborne diseases that we are experiencing. Next. There is a public health impact to this. When we look at the microclimate, we are looking at loss of canopy, urban heat, urban heat problems, bad buildings leading to cardiovascular distress, heat stroke, respiratory failure. The water pathway is untreated sewage, stagnant pools, leading to neglected tropical diseases, dengue, malaria, then associated with gastroenteritis. We have metal bioaccumulation. There's a huge vulnerability for peri-urban regions and informal residents. From the microclimatic thermal pathway, again, it's the outdoor people and informal people and people who are on the roads that are going to be affected inequally, as opposed to people who are using vehicles, air-conditioned vehicles, and air-conditioned homes and air-conditioned offices. So there is an inequity around the pathways that we are looking at in terms of the health impact. From an airshed perspective, the air pollution perspective, the vulnerable are the old people and the children and the pregnant. And this leads to challenges associated with increasing birth disorders, apart from chronic asthma, COPD, that is, and cardiovascular inflammation. So, a lot of toxicity because of the air toxins, and air toxins really kill, whether it's the particulate matter or nitrogen oxides or the sulfur dioxides. And all of these really have their criteria pollutants, and they far exceed what should be the permissible, what is the permissible limits. Next. There is a labor productivity crisis because of this exposure, and this would lead to GDP loss. And there are estimates over here. So the working hours lost for due to heat stress is 4.8%. Full-time jobs lost by 2030 is 34 million, and people across 140 Indian cities facing dangerous heat stress by 2050. The number is 360 million. And 80% of urban residents live, and I've mentioned this number before, they live in climate vulnerable districts, high hazard exposure. Next. And informal settlements have the exposure. The slum residents, the flood zone exposure, and heat mortality, which is 3x. And 17% of urban India has compounding hazards. They have tin housing, microclimate, heat traps, flooding, no piped water, heat exhaustion, heat stroke, and infant mortality. And all of this is happening now. It is not in the future. Next. There is fragmented institutional architecture. Whether we talk to urban local bodies or pollution control boards and development authorities, and only 35% of cities have notified master plans, and convergence for department is where convergence for departments is required currently. And I'll give you an example of what I am facing. And this is a right example for fragmented institutional architecture. I live in a peri-urban area and I am exposed to air pollution because there is garbage dumping happening, and there is no mechanism by which the village here where I'm residing, Hinsawari, they don't have a proper waste management. So it gets burned. That burning comes into my house at night. And that is the exposure we have to air pollution. It is a terrible, terrible plastic burning smell, and a variety of things get burned over there. There is a river from where we draw the water, and sewage untreated from the village is going into that. And Gram Panchayat knows, and the Pollution Control Board has issued a letter to the Gram Panchayat about the pollution untreated non-working STP. No action has been taken. And PMRDA is responsible, the development authority over here. And when we as residents go to one authority, we are sent to another authority. So there is fragmented institutional architecture, there is no accountability, and we go round and round in circles where no accountability is being taken by any of the authorities. And we are experiencing it. This is how many of us will experience. And if you are in a peri-urban area, you will experience it even more as compared to if you're staying in the city. Next. Yeah. So, of course, cross-sectoral coordination is required. Fantastic on paper. We can do it very quickly, bidirectional flows. There should be public health and infrastructure provisioning, ecological preservation, and then all of that leads to economic development or sustainable economic development. But there is severe dissonance in all of this, and no amount of graphical representation can do justice to the actual dissonance that is on the ground currently in India. Next. Yeah, so this is what I was referring to earlier. And if we have to get to climate resilience and to reduce the vulnerability and better public health, and how we can get to low carbon, sustainable, that can support sustainable growth. Okay. And environmental conditions have to improve because we forget that we are living in a physical environment. So the first thing that impacts, there are 4 P's that I want to talk about. So let's uncover the P's. That's planning, pollution, public health, and public policy. Okay, so what do we design is planning. What we reduce and what we can mitigate is pollution. What we improve is public health, and what do we institutionalize is public policy. But there are two more P's that we have to be aware of: private and public. About 80 to 90% of an urban area is owned by private, developed by the private, destroyed by the private. And it is the public authorities, the municipalities, who bear the brunt of all the externalities that the private development does. And to add to this, the public development also does not take into account proper sustainable development planning. Any project that you undergo, now we are seeing so many trees being cut, and all the riverside developments that are happening, all of them do not take into account proper principles and measures of sustainable development and carrying capacity. And in spite of the fact that now the citizens are waking up to this reality, we need to see how the six P's can help us to frame this problem of, how we can get better in terms of getting to sustainable development and hence to healthy urban planning. Next. I think capacity has to be an enabler. Uh, and the crisis is real, and there is cost that is shifting, and it is shifting to us in form of our health, in terms of labor productivity. It is also shifting in terms of how cities are managing all of this extensive flooding, too much of heat. And now you see some of these reactive measures coming up on the heat action plans and the air quality action plans. Where are the proactive planning measures? What should we be doing way ahead when we need to have a very dynamic, health centric model driven with governance rather than rigid land monetization master planning, which accounts because the costs have shifted. It is the cost or the burden that the cities have to bear and the burden of health that you have to bear. Next. Yeah, together actually we can do this. And with that, we will move to the next part, which is I'll introduce all the speakers. Today we have with us Dr. Sharad Guttikunda. He's the founder of Urban Emissions Info, and he's an adjunct professor at Indian Institute of Technology, Delhi, and he conducts research in an independent capacity to support science, policy, public dialogue on air pollution. And he will today share reflections on shared air pollution, and urban carrying capacity. I have been following his work since 2010 or earlier. Amazing set of work, and really we are fortunate to have him here with us today. Next speaker, Rishikesh Sandhe. He's PE and lead AP. He's a principal and head of infrastructure services at Walter P. Moore, India, with over 25 years of experience in water resource, infrastructure, and sustainability consulting. He will share reflections on infrastructure carrying capacity, particularly water, wastewater, and urban infrastructure systems. I've known Rishikesh since 2019-20, and we have had the good fortune to work together on some of the projects in my previous avatar. Dr. Mahavir Golecha, he's our next speaker, professor, IIPH Gandhinagar. He's a renowned public policy and global health researcher with over 15 years of experience at the intersection of climate change and sustainable development, health systems, and evidence-informed policymaking. He will share reflections on public health and health implications of urban growth and climate risks. At GBPN, we have drawn from his expertise in our project on healthy buildings. So, welcome you, Dr. Valecha. Our next speaker is Manish Mohandas. He's a program officer for resilience at UNDP India, where he leads the resilience and disaster management portfolio. And he will share his reflections on governance and the role of institutions in managing urban carrying capacity. And with that, we are on dot actually to start the uh, panel discussion. And the first question is actually for Dr. Sarath Guttikunda. So, Sharath, we have seen that urban growth places increasing pressure on natural systems. Air quality is one of the clearest indicators where cities whether cities are operating within or beyond their ecological limits. From your work on air pollution across Indian cities, what do these trends tell us? And whether our cities are living within their ecological capacity? What are the early warning signals that planners should not no longer ignore? Over to you, Sharat.
Bye. Thank you. Thank you for giving me this opportunity to talk about carrying capacity. And I think some of the points that I wanted to mention, you also touched upon them. Uh, these are basically numbers. Carrying capacity at the end means numbers. And I'm going to focus primarily on air pollution only and not the other topics. So when we talk about carrying capacity from air quality perspective, there are a couple of things that we can't ignore. And one is health linked air quality data. And when we talk about air quality in India, Delhi pretty much comes as number one place that we talk about. It's always in the limelight. It still is in the limelight, even though a lot of action is actually happening there. If you look at the last 7 years, and as an annual average of air quality for PM 2.5 data over Delhi, uh, data coming from 40 continuous monitoring stations, it averages 100 micrograms per meter cube. That is 20 times more than WHO guideline. WHO guideline is 5 micrograms per meter cube. And Delhi is not the only one with an annual average of 100. So we have multiple places across the Indo-Gangetic plain. And when we talk about carrying capacity, is Delhi's carrying capacity 100? Is that being exceeded or under it because of activities happening within Delhi? That's where a lot of understanding is lost. Because a lot of pollution that happens in Delhi is not about just what Delhi is doing; it's also coming from outside. Not as far as 100 kilometers away. We have close to 30 gigawatts of power plant generation happening in the region, and they all contribute to the problem. So, and it's not Delhi's own problem. So, while we talk about carrying capacity of a city, I think we have to change our understanding, especially when you're talking about planning. We have to change, we need that shift from urban to a regional planning. Okay. So as a region, if we are exceeding, and we are exceeding, so how do I bring down the averages across the region? Because we can't do it just in Delhi or just in Meerut or just in Jharkhand. No, it's not possible. I mean, you have to bring down the entire region down. So when we talk about carrying capacity for an urban design, we actually lose the battle from the beginning. So it has to be a regional design with health as the primary focus. Uh, for the longest time, we never spoke Mumbai in the same breath as Delhi. But in the last couple of years, Mumbai has been making a lot of headlines saying, okay, our AQI is also going up. We are also in the same bucket as Delhi. Now, this is in spite of having a very strong western sea breeze benefit that that Mumbai always had benefited from. So what has changed? You know, the carrying capacity, I want to use that word, what has changed in Mumbai? Let's say Mumbai last year was producing, or 2 or 3 years from now, producing 100 units of pollution. Okay. Sea breeze was taking away 50% of that. So it was experiencing 50 units of pollution within its own airshed. Okay. We can't increase the carrying capacity of the wind. Now we are producing 120 units of pollution. That wind is going to take away only that 50. I mean, that's the capacity that it can hold on a year-to-year basis. Meteorology is not really changing. That 50 is gone. Now we're experiencing 70. So that is totally coming from internal activities. Okay. So we have to look at it from that perspective. So this is the carrying capacity. Are we exceeding it? Yeah, and we have to try to find a way to quantify that. And for the longest time, we were only talking about particulate matter only. Okay, and that's been the core pollutant for pretty much everything. But in the cities, the chemical nature is actually changing. When you actually about if you look at the AQI bulletins issued by the Central Pollution Control Board every evening at 4 p.m., if you look at an annual histogram of which pollutant is responsible for AQI highs, nowadays about 5% of the days, especially over the summertime, ozone is popping up. Okay, 5 years ago that was not the case. So, which means that whatever the system we had in place 5 years ago for the city to talk, we exceeded that. Okay, so now ozone and all the other gases are also coming up, showing up, saying you can't ignore us anymore because we're going to do our role. We're going to harm you in whichever way we can. Okay, so you have to change the way you are planning. If you're only planning our PM 2.5, go ahead, but we're going to do our job. Okay, so we have to the problem has become a multi-pronged. So when we're talking about planning for carrying capacity for a region, so for a city, we have to take the region into account, and we also have to take this chemistry into account to make sure that the plan actually works, because health is at the center. Okay, I'll stop there. You're muted.
Yeah, no, I really, yeah, thank you. Ozone is coming up definitely, and Bombay air pollution has really, it's raised its profile over there, and it's no longer can be ignored. And thank you for explaining that so succinctly. The next question is for Rishikesh, actually. So we're looking at environmental stress from one side of the equation, right? And heavily cities are being tested, the infrastructure systems, and I'm talking of water-related systems that are increasingly being tested by climate change. And, I think private developers do forget that they are tying into a city infrastructure which cannot take what they are trying to put out. So our cities continue to experience flooding, water stress, and there is a significant infrastructure failure, despite there are some significant investments. From an engineering perspective, where do you think are failing? And I do want you to dwell on what kind of rains we are experiencing and what kind of infrastructure we are building to handle the type of rains that we are experiencing.
Right. I guess good timing for this question, as I think the Pune city itself went through some very hard rains in past few weeks. I think in general, I think what is, like you rightly said, I think we have a lot of development going on, but we continue to plan our infrastructure in isolation. We continue to plan our development in isolation with what is happening outside in the city. It is interconnected. Historically, when it comes to water and when it comes to rain, we are kind of so much used to following a stable statistics in general. A lot of thumb rule systems were going on, and which was all right. But past few years, because of this climate change, everything has gone for a toss in general. So there has been lot of flashy events, lot of high intensity, short duration events that have been happening more frequently in there. So that the traditional approach may not work now. So what our observation is that we basically are planning for the growth, but not looking at as an ecosystem. So we are looking, when it comes to capacity, we are not looking at the water availability, the groundwater sustainability, ecological health, and the way the land use is changing, and obviously the climate change, what is happening. So uh, the city may have enough capacity right now, but I think as we dwell into the future, I think the groundwater levels are already declining, as you rightly mentioned in your presentation. The watersheds overall there's a lot of degradation happening, and then the heat stress is very much consistent. So I guess the typically the kind of question that we need to delve into, to ask that whatever we are developing, or what are the growth we are aspiring, does our natural ecosystem has that capacity to sustain that growth? So that's the question. That's something which we are missing, that I think we need to definitely, I think, bring into picture. Uh, Another thing is we look at the cities as the administrative boundaries instead of watershed. water doesn't follow administrative boundary. Water always follows the watershed. So I think that's a key aspect that we need to take into account when we are designing the water infrastructure. Uh, that's why a lot of time, even though certain city may not have enough rainfall, but still they receive a lot of flooding because of the catchment rainfall in there. So we need to look at watershed. Watershed has a lot of functions. Watershed has function of storage, recharge, infiltration, and as a ecological perspective also. Another aspect is that whenever we are designing the water network, we basically are designing the water network to reach to every nook and corner, which makes sense. But then we are putting a lot of energy into it. What that means is that we have to lift a lot of water, and then we have to carry that water as part of the distribution system. So a lot of pumping system goes into play, which requires a lot of energy. So instead of that, I think there's opportunity for recharge, rainwater harvesting. A lot of these things can be decentralized, the wastewater reuse, and bring into play the distributed water system. Other thing is we need to look at disaster management, which is more of the extreme event, historical events which are happening more frequently as part of the climate change. So in both the scenarios, also the excessive rainfall scenarios also, and longer dry period scenario also, because of higher temperature. So that also needs to be accounted as part of your carrying capacity. So at end of the day, I think we need to look at water system. We need to look at water as a system in general. We need to look at water as a resource. It's not a problem if you look at it and if you manage it appropriately. It's not a disadvantage. It's an opportunity water has. I mean, historically, a lot of cities, all the cities are developed around a certain type of water feature, either it is river or water bodies in there. We need to have the carrying capacities developed as the climate, which are climate adaptable in there, and at city level, the carrying capacity the carrying capacity strategy should be incorporated as part of the plan, as a city development plan.
Thank you. Thanks. And with that, we will move to Dr. Kolecha. And so ultimately, when ecological and infrastructure systems begin to fail, the impacts are experienced by the people. And you have worked extensively at the intersection of climate and public health. How are heat, air pollution, and environmental degradation changing the disease burden of Indian cities? And why should public health become a central measure of urban carrying capacity?
Yeah, thank you very much. So I think based on my experience of working with, in the area of public health, the most important change is that urban environment risks are no longer separate risks. They are interacting risks. If we talk about Indian city, we are increasingly seeing the convergence of extreme heat, air pollution, loss of green space, urban heat island, and it is also linked to poor housing, traffic congestion, and also occupational exposure. These exposure interact with existing vulnerabilities such as age, poverty, as you have already mentioned, informal employment, housing condition, and access to healthcare. Just take example of extreme heat. So heat is not simply about discomfort. It also there are many evidences available now. It increases the risk of cardiovascular and respiratory diseases, renal dysfunction, heat-related illnesses, occupational injuries, and premature mortality, also causing maternal, and child health issues as well. And the people most exposed are often those with least capacity to protect themselves. For example, construction worker, outdoor worker, street vendors, sanitation workers, traffic police, agricultural worker, and people living in poorly ventilated housing, unhealthy housing. Similarly, air pollution contributes substantially to the respiratory and cardiovascular diseases, while environmental degradation also increasing exposure to multiple hazards simultaneously. The important point is that climate change is changing the baseline risk environment of city that we have to understand. For example, a person with cardiovascular illnesses may already be vulnerable to air pollution and extreme heat, dehydration, occupational exposure. And the risk is no longer simply the sum of four individual risks. These exposure can interact. This is why I believe public health should be one of the central indicator of urban carrying capacity. So I would advocate for health adjusted urban carrying capacity where urban planning decisions are assessed not only against infrastructure and environmental threshold but also against their likely impact on mortality, morbidity, exposure and health inequalities. And based on my experience exclusively with the heat action plan work, the temperature itself is not the whole story. Two neighborhood experience the same 45-degree centigrade can experience very different health risks because of differences in housing, tree cover, socioeconomic condition, access to healthcare and other basic necessities like water. Therefore, resilience has to be people-centered and spatially explicit. If a city economic growth is increasing, the number of people who cannot safely breathe, work, or live through a heat wave, then we should question whether that city is actually becoming more resilient or not. Thank you.
No, thank you. I mean, those points are really hard hitting, I would say. And then I would like to move to Manish. Manish, recognizing these risks are only the first step, and we're going in a sequential fashion and rightly coming to you that what the challenge is how institutions respond before these pressures become disasters. And India has put heat as a disaster. They have classified that, while at the same time they have made footpaths as a basic human right in the heat. I mean, imagine concrete footpaths. Sorry, I'm just pun intended. But cities tend to respond after crisis occurs, right? So, and they are all reactionary measures. And I'm from Nagpur, very hot place in summer, very nice place throughout the year almost. And the heat measure, the heat action plan, some of the measures is putting that green net, which is a reactionary measure. Proactionary but reactionary, it's not a planning measure. And how can governance shift from disaster response towards managing long-term urban resilience through a carrying capacity lens? And can we move from getting to how we react to some of these things and how authorities react to some of these things to actually looking at it from a planning and a carrying capacity and a larger regional lens?
Thank you, Dr. Sankar, for that framing. See, when we talk about disaster management, over the last few years, what we see is that the people who die from disasters, the mortality from disasters has really come down. We hardly have deaths due to disasters these days. And I think the the fact that we reached here has been a culmination of years of interventions in making sure that people don't die. Now, I think what is needed is to make sure that the same is applied for economic losses and also for kind of general mobility of the populations. What I see is that I mean, as someone working in disaster management, the amount of knowledge around risk that cities are now have access to has gone up. I mean, you have multiple cities that know what their risks are. They know the risks due to floods. They know the risks due to heat. That information about risks through hazard risk and vulnerability assessments has really been exponentially going up in multiple cities. But what is lacking is the ability to use these risk assessments into your day-to-day planning. Now, and I think there are multiple reasons for that. One is, of course, capacities. I mean, you don't have institutions that have the capacities or the cadre of professionals who can really look into these issues, who can work across silos and bring all of this together. So that is one glaring kind of challenge that we see in multiple cities in most places. Secondly, is that in terms of resources, I don't think any cities struggle with resources as such. From a disaster management point of view, the allocations that have been made by the 15th and 16th Finance Commission specifically for disaster management is quite humongous. I mean, I think nationally we have around $30 billion that's available for disaster management. And the fact is that a lot of this is still unspent, mainly because you do not have the capacities to really program these funds and utilize this for efficient modeling. Now, in the example, and then there's also this whole political economy in which we operate. So I'll just give you that example that you mentioned in your opening remarks about burnt plastic entering your house through fumes in the night. Now, the fact is that there is no mechanism in the country for us to protest, for us to kind of raise this as an issue or accountability to come from because what happens is we sometimes have MPs being involved in your city administrative issues. You have MLA showing a lot of interest, but whereas we don't have strong mayors. So I think there is also this whole haziness between the role of the legislative part of the state and the administrative part of the state or the executive part of the state. And somehow I think it is also this illiteracy amongst the electorate to not being able to kind of make this differentiation is also one reason why we don't have strong accountable features. So even when we work with municipal corporations, you have the municipal commissioner. Now, as per the new act, you have urban disaster management authorities when there is already a state disaster management authorities. So when you have this multiplicity of institutions, it's very difficult to pinpoint responsibilities and to see who takes the kind of onus for all of this. Air pollution was also kind of, since I live in Delhi, it's something that's affecting me on a daily basis. But again, even in the example of Delhi and Bombay, it is an issue that has come to the national focus primarily because the elites are involved, because we have the judiciary here, the Supreme Court is here, the judges themselves are breathing toxic air. So there's a lot of judicial activism that is driving this. And also the media and the kind of diplomatic code that is present in Delhi is also kind of, because of all of these reasons, you have a lot of thrust in terms of how do we kind of respond to this crisis. And over the last 10 years, it is only now that we're now at least reaching a point where we have the political messaging saying that we are trying to be proactive this time. We are trying to make sure that we have a air pollution action plan well much before the November season hits us. So those are all, I think, positive steps in the right direction. But again, I think until we have a kind of professional cadre of experts embedded at city administration, until we have a citizen redressal mechanism that is well in place, we'll always have this lag between an emergency hitting us and a reaction to it. I haven't spoken on carrying capacity, but I think I'll come back to the second on the second question because I have some nuances on how we frame this. Yeah, so I'll stop here.
Sure, thank you. Rightly said, Manish. And I'll wait for your comments on the how we can embed it into the planning
Sure.
process. We have to resolve this, the multiplicity of authorities and where does the citizen go and complain and how does it get addressed is also needs to be thought through, right? Yeah. So I'll circle back in a systematic fashion back to Dr. Sharath. So Sharath, over to you. Today we have, better environmental data, but yet planning decisions often proceed without effectively using it. So we are looking at the evidence, environmental evidence, such as emission inventories, monitoring, urban heat data, and how they can become part of statutory planning and development approvals when it comes down to both public infrastructure as well as the private infrastructure, right? Rather than it becoming just standalone studies. And Manish was also referring to it. The information is coming in, but how do we factor this in? And in your experience in context of air quality, would like to understand how that can be, taken up.
Hi, thank you. Yes, we do have data, but I think I'll probably say that there are lots of holes in it. But the data is coming in, and I want to actually demonstrate a little bit on when I say where the gaps are. This actually ties up a little bit with Manish's risk assessment concept as well. So we are talking about health, right? So when we talk about an urban plan, we want to have a good urban plan, which means that at least from an air quality perspective, I want to make sure that whatever data that I'm collecting and reporting and using for planning purposes or risk assessments, I have a representative sample of that data. And when you go to CPCB's website or MOEF's website, it will say we have 600 continuous monitoring stations running and they're reporting a lot of information. But if you break it down a little bit, where are these stations located? 80% of the cities have only one station. 92% of the cities have only one or two stations. In any mathematical world, whether it's air quality or water or climate, in any fields, one or two stations are not a good sample to represent what is happening, what we are exposed to in a city. Okay, and so this is where I want to talk about evidence, where that yes, we can build an emission inventory, we can set up a monitor, but is that being a representative sample or not? So bear with me for 5 minutes. I want to share a little bit. So it's on our website. It is called AQNest, Air Quality Network Evaluation and Siting Tool. The idea is, again, the only existing information, we're not making anything up. So this is the monitoring network that is already operational in India and across India. So let's focus only on Delhi. This tool is online, so you can actually go and use it. So if I draw an airshed around Delhi, so this is the airshed around Delhi that we have designated. If you don't like the box, you can also just draw a polygon saying, okay, I'm only interested, sorry, yeah, in how only around Delhi. So like, okay, let's just focus only on Delhi. Forget about whatever is happening outside. So going by the thumb rules alone from exposure perspective, the CPCB's own thumb rules say for a box like this, which is holding about 23 million people, and area is about 2,000 square kilometers, CPCB's own thumb rules say we need 102 ground monitoring stations, which can ideally represent what is happening here. I want to toggle the population in the back, okay, because exposure is directly linked to population. So I have all these stations on this side, on the right-hand side, okay. So when I open an app for Delhi, it tells me Delhi's air quality is XYZ, okay. That is coming from these stations. So when I'm sitting somewhere on this side, is that representing air quality that I'm breathing in this area? No, actually no. So when we're talking about evidence and then the carrying capacity, we need to have an understanding of this. Okay, are we generating information that is representing what we are trying to plan for? Okay, so these circles are also thumb rules. So a general thumb rule says that a air quality monitoring station represents a radius of 2 kilometers. It's a thumb rule, but it's a good thumb rule. So we basically, okay, looked at how much population is this circle covering. So we look at it, it says only 42%. In this box, these stations are able to cover about 42% of the population. Okay, and it's mostly represented here. So we open this up so you can actually put in, look at any of the other airsheds as well. So if you go to Pune, no, it's a good place. Again, so there are 2 or 3 thumb rules that you can go through. I won't go through all the details, but Pune Pimpri Chinchwad airshed has a representation of only 28%. Okay, ideally speaking, they should be operating about 70, but they're operating only 17 monitoring stations, and they're concentrated like this. Again, if I toggle the population, you have a very high population density in this area, but we are not measuring anything. Okay, so for example, why these two stations are next to each other like that? When they're so close that they're probably reporting the same number. Okay, but wasting the resources a little bit here. So how can we look at the data that's coming in to make a better representation of the metric, the only metric that we are interested in, exposure? Okay, so I'm setting up a monitoring network. I want to make sure that my network is representing what I am interested in. When you go to Vizag, why a city like Vishakhapatnam has only one monitoring station is mind-boggling. So is this monitoring station very close to the port area in that area? Is it representing what is happening in the city? Okay, especially from a health perspective. Okay? Is it representing what is happening in the city? No. So when we talked about raising evidence and talking about using that evidence to explain a city's plan for carrying capacity, I think this is where we actually falter. This is something that we really need to make an integral part of the design, saying that no, okay, we understand the theory, but we want to populate with proper evidence, representative evidence. Okay. So I think this is where we want a good urban plan for a growing city. So this has to become a non-negotiable baseline tactic. Yeah, I'll stop here.
Point well made, Sharath. And there could be a counter question to that, that can modeling come in instead of actual data? So, I mean, we can discuss
No,
that. Yeah.
no, absolutely. A very short answer. Absolutely. Modeling can come in and modeling has to come in. But that modeling has to build on a ground truth. That ground
True.
truth will come only if we have a representative network in place. Yes.
Absolutely. Agree. Thank you. Thank you so much. Very, very, very valid point. And I'm sure you've shown that in context of air, and I'm sure you would have similar kind of data gaps when it comes to water and water quality and water stress, perhaps. Yeah. So with that, I move back to water. So between air and back to water. Now to you, Rishikesh. Climate resilient infrastructure is about building not only just building more infrastructure, but designing systems that work with natural processes, right? And what could be the interventions that you could suggest that cities could take, cities that are expanding, that can help improve their resilience to flood and water stress?
Yeah, so I think from the system perspective, like you mentioned about 4 Ps or 6 Ps, I think something related to water is like 3 Rs. It's like recharge, reuse, and recycle. So I think that something is one of the key solution in current times. How you go about it? Uh, there is uh, a common approach is watershed planning. I think we have come across, for example, in our country, I think there is this data available for a lot of major rivers, but I think probably at city level we are not practicing this exercise of watershed master planning, because that's something will give at city level or at town level, I think, an understanding of how the water, from where it's coming, what are the opportunities are for storing, recharge, reuse. So I think that's something is one of the aspect. Typically, I think if we do it right, uh, about 20 to 30% of the first flush, what we call it, can be stored and can reduce a lot of flooding downstream, which is not happening currently. And obviously, the first flush also incorporates to the water quality also. Uh, Wastewater, we already talked about that wastewater treatment as part of the carrying capacity needs to improve. There is a lot of opportunity there to increase the capacity of treatment plants and then decentralize wastewater treatment also. That's, I think, it's an immediate need. One other area which I think has a lot of opportunity is nature-based solutions. What we call it is low impact development, or can call it, well, a lot of different names are out there, SURDs and all those things, which is in principle is the decentralized opportunities of finding out different technologies and tools, whether it is open spaces, whether it is underground, whether it is pavers. Uh, those are again an opportunity where if it's engineered properly, it can help in reducing flooding. It improves the groundwater recharge, water reuse, and also it has contributed significantly in the urban heat. Uh, and that's where the engineering creativity comes into play. I think if engineers are given opportunity to work with the planners, the city planners, I think at the right time, as simple as that, a lake restoration project, for example, instead of just focusing on the beautification part, can be utilized and can be engineered for flood storage, recharge, and biodiversity related solutions. A city park can be utilized. We have worked on one of the project where we have utilized a big ground where it can be converted for more frequent event as a storage opportunity in there. A lot of road corridors. We have seen a lot of road flooding happening, which impacts your traffic movements and everything. Again, there's an opportunity about how to design those road section where it can improve the carrying capacity of the road. I cannot stop without mentioning the whole digital aspect. When it comes to water infrastructure, there's always a struggle of getting the information when it comes to utilities. So I think digitization of the utilities, collecting of the data, making that data available for the designers and planner is going to add lot more value. The application of technology, after you have that data, you can utilize that data for proactive mitigation planning. In there, we are currently working on a lot of AI tools where we are helping. We can help actually clients and city stakeholders on how to do the utilize AI tools for doing proactive decision making. So I think these are some of the key tools which I think can be utilized as part of the engineering process.
Wonderful, wonderful to hear some of these developments happen as cities are experiencing, especially what you mentioned about, roads. They build a road and they realize that there needs to be some intervention that needs to be done because they've not thought about it. And blue green, there is a role of blue green infrastructure, SUDS, that is sustainable urban drainage systems, and now coming under this big bucket of nature-based solutions, like which everybody is trying to understand how to do it and how best to do it and so on. So great points you mentioned. So back to you, Dr. Golecha. As we look at health, which is viewed as an outcome of planning rather than a driver of planning decisions. And if health were to be treated as a planning objective rather than simply a health sector responsibility, which often is the case when we go and meet the health department and public health department in the municipalities, what indicators should cities begin to track? And how would that change planning priorities?
Yeah, so in health system we always talk about health in all policy, but from city perspective, I think cities should move towards a health in all urban policies. Instead of asking the health department to report some of the health indicator once in a year or maybe quarterly, every major urban department should have measurable health related indicator. And based on my experience with working with urban health at city level, I think five broad domain can be included. Number one, the exposure. We should measure like population exposed to extreme heat, number of heat wave days, and we should identify the urban heat island intensity. Uh, in with respect to air pollution, we should have PM 2.5 and other exposure indicator, and also access to green and blue space under exposure. Importantly, they should be mapped at neighborhood level. What now city is doing, they are measuring at city level. So we should measure at neighborhood level. Second domain should be health outcome domain. Cities should track heat related mortality and morbidity, air pollution attributed health burden, which most of the city are under integrated disease surveillance program. They are monitoring occupational heat illness, which is not there. Emergency department utilization during extreme event, that is one of the important indicator. And we should establish a heat health threshold specific to city, because the same temperature does not necessarily produce the same health risk everywhere. Within in third domain, we should have vulnerability and equity aspect. And I think this is the most important dimension. Which neighborhood have the highest heat exposure? Where do vulnerable population live? For example, elderly, pregnant women, informal settlement. Where are outdoor workers concentrated? Which areas have poor access to healthcare and basic infrastructure? Which community have limited access to cooling, water, and again blue and green infrastructure? So don't just map where heat is, map where people at risk are. In fourth domain, which is related to health system resilience, we should track whether health system themselves can continue functioning during climate shock or during hazard situation or during disaster situation. Under this, hospital preparedness for heat wave, power and water reliability, access to cooling centers, climate sensitive disease surveillance, early warning system and its coverage. Most important, its coverage. Not only having early warning system, percentage of health worker trained in climate related health risk or climate sensitive diseases. Fifth domain would be urban policy and action. Finally, we need indicator that measure what measure cities actually taking, like increase in urban tree canopy, access to shaded walking or cycling route, heat resilient housing, cool roof and passive cooling, that is one of the important intervention, protection policies for outdoor worker, climate resilient infrastructure, for example, school, implementation of early warning, how well they are implementing the early warning system, And if we follow this, I think this would fundamentally change the question asked by urban planner. Today, the question is how many more people can city accommodate? Instead of that, we should ask how many more people can this city accommodate safely, healthily, equitably under future climatic condition. That changes city priority planning and important investment decision. Thank you.
Wow, these are again very, very pertinent and the right questions that have to be raised, and a lot of pointers as to what could be the indicators and how it can be, becomes part of the how cities should change their planning priorities, informed on basis of health. Brings us back to Manish, and let's start with the carrying capacity point that you wanted to make. How can we integrate that into, embed it into planning? What changes will be required in governance, finance, and institutional capacity? And especially, and how all these reforms or mechanisms could help urban local bodies really function better and integrate carrying capacity into their planning, investment, and decision making
Yeah.
measures.
Thank you, Dr. Sunita. So the qualification that I wanted to make is that when we, at least for me, when I hear the word carrying capacity, it sometimes has a connotation of a static concept. It's as though that a city has a limit, and once we cross that limit, we are all in trouble. So I think the challenge here is that it also kind of kills the space for innovation, for human ingenuity. Cities are engines of growth, right? People come here for work, for building their lives, and they're kind of magnets of talent. And I think when we frame the issue around carrying capacity, we probably kind of, in a way, psychologically are setting limits to what a city can offer or city can do. What we probably need to see is that when we look at ecological limits. Now, for instance, if I do a flood modeling of a city, of a river in a particular city, I very clearly can demarcate what are the floodplains or the zones where no construction should happen. Or if there is a hill or a unstable hill slope, I can identify the kind of risk parameters based on slope stability around which you should be very careful in terms of doing any intervention. But beyond these constraints, I think cities should be allowed to thrive, and I think that is where regulators and kind of urban planners come into the picture. Now, I'll just give one example. Now, for instance, again, I stay in Delhi. Delhi is one of the few cities in the world where the entire central part of Delhi is flat. There are no high rises. You won't find a single skyscraper. You will find all, I mean, single occupancy bungalows that are just kind of occupying the whole of Delhi. And even most Indian cities, we don't have this concept of the central business district like Hong Kong or Tokyo or Manhattan. Now, the reason is that a lot of this is linked to your floor to area ratios, the regulation that we have in terms of building vertical. Why this is so, I don't know, there's a lot of reasons to kind of go into that. But I think this also has implications on the kind of development of urban sprawls, your kind of air quality, the manner in which you're able to kind of tax the kind of the income base from which you're able to raise property taxes. So I think it's when you think of all of these problems, it is not just carrying capacity that can kind of that can come out as a solution, but in fact, how do you kind of reimagine your cities through all of these regulatory interventions? That is one point that I want to make. Secondly, it also mentioned that there is a lot of the negative externalities of the private sector is often borne by the larger public. Again, the fact is that there are no checks and balances in the private sector, primarily because you do not have good regulations. You have very poor regulation where human health is very often not given a premium, where you do not these constraints, these ecological constraints that a city is facing is not kind of converted into hard kind of boundaries that the private sector is not allowed to kind of cross. So I think that is where we find all of these issues that come into picture. And I think how do we strengthen this? I think again, urban. I'm not very sure whether municipal corporations are the right entry point, because at the end of the day, the city administration is centered on a municipal commissioner. You still have the legacy administrative mechanism, right, from junior engineers at the grassroots level, right upwards towards superintendent engineers. So sometimes you probably need to have, I think, for a 21st century, for Indian cities entering into the 21st century, we need to reimagine the way we're also structuring the cadre of engineers and experts that we have embedded in cities. So I think I can just pontificate in a few minutes about all of these things, but I think this is where, for instance, all the expertise that we heard today, right from urban emissions, this modeling that we see, We can do this for multiple interventions. We can do this for floods. We can do this for air pollution. We can do this for heat waves. But the question is, who's the custodian of all of this information at a city level? I think embedding such knowledge at a city level and then linking it to planners, bringing in a system approach with the transport department having a stake in it, with the health department having a stake in it, with the education and schools having a stake. And I think that is a larger challenge. And I think that is where we need to kind of push efforts into and trying to see how cities break out of these silos. So I'll stop here for now.
Thank you. Thank
Yeah.
you. And that brings us to one interesting section of this discussion is if any one of the panelists wants to reflect on what the other panelist has said, now is the opportunity. So any one of you would want to respond or react or agree, to what the points have been made so far. Um, it's the opportunity now. Any one of you would like to?
Yeah. Yeah.
Yes, sure.
Hi. I like the zoning point. This is something I had it earlier to talk about, but I kind of zoned over it. Um, when we look at our cities, we have a very heterogeneous setup. Like, for example, if you take a city like London or Washington D.C. or Paris, their main challenge comes from transportation. Whether you talk about climate change, air quality perspective, or the design, urban design perspective, their main challenge is transport. But when we talk about our cities, like Pune, Nagpur, Delhi, Hyderabad, Bangalore, any of them, it's not just transport. We have a very heterogeneous setup. So this is where things get a little bit more complicated. So when we're talking about planning, the social equity comes into picture because when we look at roads, pretty much 70% of the road is taken over by private motorcycles. But if you look at the model shares of how people actually move, an empty and public transportation are actually the biggest chunks, but they don't get that same the equity on the road. So this zoning point is very, very important, but even from an air quality perspective. So if we have a mixed sources everywhere, it's hard to come up with a solution that and to also enforce it. So if we have zones saying, okay, this is my main industrial area, and all the combustion activities from an industrial level are going to happen there, then it becomes very easy to actually enforce regulations. But if those industries are scattered, if you go to Hyderabad, these SMEs are like scattered everywhere. You will have some small bhatti happening somewhere in the middle of the city also, and also on the outskirts. It's really hard to then have that enforcement in place and a good urban design in place. So the zoning is a really, really an important concept, and especially when we talk about building or designing at least a healthy urban setup. So how do you separate out these activities where you have a very clean residential area that will be your lungs with proper parks and everything else, and then you have an industrial zone where you can actually put your foot down and say, look, you have to clean up. So this is something definitely is missing in our city designs.
Yeah, thanks, Sharath. And Manish, I actually wanted to react to some of the points that you were making, especially, yes, there are physical limits to growth, and it appears to be a punishing statement that there is a carrying capacity. And like Sharath explained, yes, it is a physical reality, right? And hence, how can that carrying capacity be enhanced will depend on the way you're developing it and way you're planning it, right? And you cannot keep putting more and more polluting activities and assume that dispersion will happen or the water will. So basically you're adding more salt to the water and it'll become brine water, and that brine water will be not usable. I mean, if you look at pollution similar to salt. There is a physical limit to things, right? There is a physical, and there is a reason why cities were planned with that kind of low-rise development, and which then acts as regenerative, or it acts as a mechanism to enhance the carrying capacity. So if you have that tree cover, and if you have that spacing out, and if you have that, so all of that becomes regenerative, and therefore that region can sustain, on its own, and because it is designed to be in tune with that carrying capacity. So once you exceed it, it becomes a problem. So just wanted to react to that, and of course we can debate and see how that can be communicated out to planners. Yeah. Any other people want to react to what Rishi had said, or Dr. Golecha, the points that were being made? Anybody wants to ask any more questions to your co-panelists? So now is the time.
I think I'll just mention something very quickly, ma'am, that I think that's the zoning point which made is a very, very valid point. Same thing applies. There are in other countries there is a concept of conservation easements, where even for this is not limited to like major river bodies or anything, even for smaller river bodies or smaller nalas in our terms, there is an easement where you basically are given a buffer of open space, so that it gives opportunity for that water body to expand and kind of flood during worst case scenario, but also gives opportunity for open space in there. So again, I mean, and enhancing the carrying capacity of existing ecosystem, there are different ways to do that also.
Yeah, interesting. Uh, Anybody else? Dr. Golecha, you have any questions for your fellow panelists?
Yeah, so I think I agree with what Mr. Manish has said, that you are generating so many evidences, but who will use them? There are many things with municipal commissioner. They are overburdened. There are lack of human resource capacity. They don't have expertise. We are having lots of evidences. Like we have clear-cut evidence that heat is affecting health. This particular area is, high risk area. Urban heat island is, making here expo everything. But how they will use this information? That is, I think, one of the things researcher and people like us need to think, that how we should present evidences to authorities so they can utilize them. They want clear cut solution. They just don't want evidences. They want some practical solution, feasible solution. That I think, based on my experience of working with more than 20 cities, so I realized this. Municipal commissioner, lots of information there. Lots of map we have made, flood risk map we have made, vulnerability assessment, from UNDP, from UNICEF, from WHO. But how the same would be utilized, that has to be clearly communicated.
Yeah, so clear-cut solutioning side and what can help the city, and especially because city authorities are also struggling with multiple problems that they have to deal with. Service problems, revenue generation, revenue, getting the collections done, and so on and so forth. So there are a lot of different conflicting priorities that take their time and attention. And Manish, you made the point about the executive authorities. Then there is a elected representative set of people, and then how do they have their roles and responsibilities defined? It makes it difficult for having a system of accountability, and for to the point that where does the citizen go and how does the citizen react with the city ultimately. That's where we have to really think through. So very, very valid points. So I mean, it's open for all participants to for their questions. So we have one question from Gotham. Gotham, thanks for joining. And do you think developing a taxonomy featuring healthy cities could provide the right mechanism to mainstream key themes and recommendations that emerge from today's discussion? So any one of you can take that. Do you think there's a need for a taxonomy uh, to mainstream the themes that we discussed today? Because all concepts are not easily understood by everybody, right? So Sharat's work on modeling and how the carrying capacities work is done, Rishikesh's work on engineering, watershed, and how. So the idea is that could we then simplify it in form of a taxonomy? Uh, that can help authorities to deal with the technicalities of the things that we are now discussing? Do you think
Do you
that
mean like having a framework, right? Preparing a
having
framework
a
in more
which simplifies things for authority?
more simpler framework. I mean, I know we have bunch of handbooks and rules and regulations, which probably may be more uh, technically heavy. But I think preparing something a simpler version, which I think somebody mentioned rightly, Agmanishan mentioned about, it will help the authorities to be more capable and improving their capacity also. I think there's an opportunity for sure.
There's an opportunity for sure. Any other reflections on this question, Sharad?
Yeah, I mean, again, one could definitely build separate tools or frameworks for different components of a subject. Like within air quality management itself. I mean, if you look at the actual operations on the ground, a lot of these works happen in silos. You go to the municipality, the waste group work in their silo, and they have a certain thing that they want to do. When you look at the transport line department, they have a certain thing that they do it in a certain way. And then you have again, the road sweeping, road work that happens in a certain silo way. So if we have an umbrella program saying, okay, this is air quality management, that's how usually things are spoken, whether it's in the class or in a workshop. It really doesn't help getting the message to that operator. So when we have seen this in our own experience, when I'm talking to a waste management group within a city's air quality management plan, we don't talk about other sectors. We will talk about waste, okay? Because we need the buy-in from them. And then that kind of buy-in will happen only if we speak in whether if it's an equation or just a concept or just explaining what is a good waste management plan to them in their language.
Mm.
Language in the sense the concept
Mm.
of the topic itself, but also even local language also. So it
Mm.
actually makes a huge difference. So I
Mm.
agree. I mean, if you can break it down, subjects, even within an umbrella program, to operators, it makes a
Mm.
huge difference.
Mm. Mm. Yeah. Yeah. Any other reflections from anybody else? Dr. Gulecha, Manish? You're on mute, Manish.
The one point that I'd just like to highlight here is that we work with a lot of administrators. So whenever we talk about risk modeling or projections, I take pains to kind of convince them that don't get lost in the models, because at the end of the day, you have, if heat is an issue for you, if you have floods as an issue, the model is not here to predict exactly what 6 months down the line, if it rains for 1 hour, which part of my city will be flooded. And then I mean, sometimes we ourselves take pains and we also struggle to kind of explain to them what are the underlying math and the science of it. And at times I also get really frustrated, because what is important is to know that if you have a broad consensus in terms of which are your wards that are most affected to certain hazards, work with the communities there, work with your engineers there, and try to see what are the practical solutions that you could do. Sometimes just pre-positioning of boats or maybe early warning systems, evacuating them towards shelters, they may be more effective rather than spending a lot of money on the most accurate model that will convert every weather parameter into some sort of GIS based platform. And I think this is something that it's also nice. It's good to kind of build a community of awareness that we are not dumbing down on the science, but I think there is much you can do with a fair enough kind of model that helps you plan and prepare for a disaster.
I cannot agree more, Manish, on this. I mean, it's relevant for whether you are doing a watershed modeling or a air quality modeling. This is absolutely true that, don't try and get to the granularity and they say, oh, यहाँ पे नहीं होगा, यहाँ पे I'll construct and nothing will happen to my building, God knows. Yeah, so I mean, Rishi and I, we've worked on projects where there have been arguments around why we have to plan for a drain now. We don't know whether it's going to happen 1 in 100 years, and 1 in 100 years is so misleading. We are getting that rainfall, and then they will explain that what is this 1 in 100 year? It's going to happen once in 100 years, right? This kind of rainfall. So anyway, so and we when we get into the science, and it can be really uncomfortable for people in the business, and you can tend to pull things, it's like splitting the hair. So Manisha, I do agree to the point you're making. Any other questions, guys? We can take questions from the audience.
Again, my own experience, the groups get uncomfortable only because there is some misunderstanding of what a concept is. I'll go back to the tool that I showed you. It's nothing but just putting locations of already existing monitoring stations on the map. We didn't do any dramatic work on that. That 2 weeks ago, we were showing this to Pune Municipal Corporation, and you're operating 17 locations, and you're representing 25% of the population. Without any extra cost, if you move these 5 locations to 2 or 3 kilometers away, okay, you will increase your representation from 25 to 45. The whole thing was about they need to see it. I mean, if we talk about complicated words on, again, it's the same thing about exposure, health impact, mortality, morbidity, urban design and all that stuff, we will lose them on the second word only. But if we visualize the same problem in a simple way and just move the buttons, and they actually understood, okay, this is what a good design is. Like, why not? That's it. We stopped right there. We just want to make sure that they understand the concept of a good design. If we can visualize it in a simple way that a decision maker can understand that, you have a win.
Yeah.
Yeah.
Interesting. Yeah. So there's one more question from Dipti. Dipti, thanks for asking this question. Given the present urban scenario, how can we speeden the process of integrating health in urban planning?
I say we need to talk about it more to the officials in a way that they understand and they put it in the design. Otherwise, it's just us discussing among ourselves. It really doesn't gonna move the needle at all. You need to target the people, operators, the people who are actually taking the decisions. If they understand, they'll bring the whole design up.
Yeah, thank you. So we don't have any more questions from the audience. It's still open, guys. But we can actually go back to all the panelists here, and I need your response in one sentence, 1 or 2 sentences. What is the single biggest shift India needs to make to build health resilience?
I'll go back to what I just said. The one thing that really is going to change the needle, especially from air quality perspective, it's not just having the data in place, but making sure the decision makers understand the value, the potential of that data in explaining the story that we have on the table. I think right now, most of the work happens because they have to tick a box. When we have to make them realize the potential of the data that's coming to the table and how we can use it for a good design.
Point well taken. Rishi, the same question for you.
I think one is that we need to look at water as a system. I think we cannot just. I mean, I know we have been mentioning this multiple times, but it's the reality of the time, right? A reality of the situation right now that if we are going to develop the cities, we need to look at water as a system. We need to look at cities and watersheds in there, because that's something is very important to make sure that we can do things at right time. Another thing is, instead of reactive, we need to do a proactive approach. When it comes to water, there's a lot of reactive. That flood is happening, so now that let's start doing the mitigation. There's pollution, let's start doing something about the pollution in there. So I think we need to start doing a more proactive approach, and it should be year round. It should not be just the water should not be a monsoon business or seasonal business. It should be a year round activity.
Thank you. Dr. Golecha, your reflections on the question posed.
Yeah, so I think we need to, I would suggest few shifts. For example, as I agree with previous speaker, from reactive response to anticipatory planning. Second, based on my experience, from city-wide average to neighborhood level action, because their city are, expanding at a very rapid speed. Third, from departmental actions to institutional what is happening now? Every department is taking their own action. So there is no convergence between the institution. Therefore, health, urban development, environment, transport, water, labor, disaster management, and other department need to work from common climate health risk assessment and from measuring activity to measuring outcome. Right now, the approach of cities, they are measuring just activity, how many households we have covered, how many cool roof we have done, but no one is measuring the outcome. So that is important. Fifth, from evidence generation to implementation science. We have generated substantial amount of scientific evidence. How we will utilize such evidences, for example, what works for whom, where, at what cost, and what skills, that we have to think about.
Thank you. Manish, big shifts India needs to make.
I think we could start small by starting with the building the capacities of the municipal corporations. And I think most cities, most big cities of India have a lot of collaborations ongoing. You have researchers, you have scientists, you have young professionals working with them. And I think it's about how you leverage all of this knowledge. And I think very often what happens is there is also this urgency of getting projects up and running. Ki next 6 months ke andar hame we have to show these outcomes. I think that reactive kind of timeline is also sometimes counterproductive. So I think what is needed could be start small, start with small interventions, small priorities. Start with if heat is an issue in a city, start with actionable heat action plans. See what are the key stakeholders. How do we have matrices that you can track, whether it's mortality, whether it's number of working days that people are losing because of heat, and then try to kind of step by step bring that down. And I think then you kind of progress to the next steps. Very often, what happens is we start with these big mega projects, flood, like we want flood booked cities, and that's a big announcement that next year there won't be floods. So that's a wrong path to take. You need to start with living with floods. Floods is a reality in every Indian city. So how do we live with these floods? How do we make sure that the hardships are good? So I think that messaging should happen, and then you start with incremental steps. That's the way I look at these problems.
Wow. Absolutely. So it's acceptance is what you're saying. So how do we accept and then build resilience on top of that acceptance? So there are more questions that are coming actually. So one more that has come from Dipti, how population projections play a role in climate change and how can we limit the size of city based on population? And there is one more from Priyanka Bajaj, but I'll take it up in some time. So the question is how population projections play a role in climate change, and can we limit the size of the city based on population? Any one of you can take that.
I mean, I'm not a demographer, but I think this whole bogey of population growth being a problem and kind of giving us a bleak future, I think it's been discounted. There's enough studies to know our fertility rates have kind of plateaued. We are in fact below the TFR, below the replacement rate. And I think globally, you find that most countries are losing population. You don't have the kind of ratio of your senior citizens to the younger population is in fact going up. So I don't think population is going to be a problem. We have crossed I think 2012 was the year where India had the maximum number of children born. Ever since that year, you've had the number of live births going down year by year basis. So I think that as an aspect should not be a cause for worry. We could look at per capita emissions going down through better technologies and better interventions. But I don't think the younger generation should be overly concerned or alarmed about population. That would be my 2 cents on this.
Any other responses on this population question? No. Okay. Cool. Okay, we have one more question, and this is from Priyanka Bajaj. And does the visual of Kate Raworth's donut economics model accurately capture how we should be talking about urban development? Any takers on this question? Sharath? No, no. Okay. Should we take ideas proposed in the West to be applicable in India? That's one more question on top of Priyanka's question.
Yeah, on the second part, yes, you could take examples from there. We always are referring to lessons learned from the West or any other, even the East as well, even Beijing, Shanghai. They have shown some really good examples. But it literally comes down to implementation. Okay, can we implement at the same rate as they did? And if we even want to start, very simple example. We've been saying that Delhi needs close to 15,000 buses. This was something that we said. You looked at even in 1997, the number was 15,000. Technically speaking, we need about 30,000 now. And you look at the operating number, that's close to 5,000. Okay. There's no reason why we should not have 30,000. You look at Beijing, Shanghai, they operate 30,000. You go to Shenzhen, they operate 30,000 EV buses. I mean, that was like 5 years ago. Yeah. So yes, there are lessons. There are lessons from everywhere that we have to uh, take it. But literally, our question literally comes down to when are we going to start, and how long is it going to get it fully active? So that's a very open question to pretty much everybody. Yeah.
Yeah, yeah. So a lot of takeaways here today, and our job is to actually see how we can simplify things and get it down to the grassroots level so that we are able to break it down and develop and help the city authorities to get to actionize on some of the measures that they need to take and understand and the decisions that they have to make and look at it systematically from both the airshed and the watershed as well as from the health lens and how it has to be done. My key takeaway today is that we need to simplify, and we need to simplify to implement, because lot of knowledge partners, scientists, researchers are working with city authorities. But how do we get to implementation, and how do we build the capacity that can help us develop the cities better in India? So I really thank each one of you and your time today. And we'll take a quick photograph if that's possible. Bhavya, you can keep your screen on, and we take a screenshot of all smiling pictures. Yeah, just for our memory. And this is getting broadcast on YouTube live. It's been live streamed, and we request all of you to share this with more people in your network. All the participants who have joined today and who couldn't join can also access. We will be sharing the presentation and the YouTube link with all the registered participants and as well as with the panelists. So thank you so much, all of you, and we are well within time.
Thank you.
Thank
Thank
you for the
you.
opportunity.
Thank you.
Yeah.
Bye-bye.
Bye.
Thank you.
Thank
Bye-bye.
you.
Thank you.